You're watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. Today's topic, replacing missing teeth with dental implants. According to my first guest, he says no more dentures. Nobody should be wearing a loose-fitting denture. With us, we have an expert on this topic of dental implants, Dr. King. Dr. King, welcome to the program.
Thank you. It's nice to be here.
Now, for people that don't know your centers, I guess you have offices spread all over Albuquerque, all over New Mexico. So who's the typical patient? What are the different services you offer? And then you're part of this smile generation. So tell me about that too.
So I'm a general dentist. I practice in Albuquerque and Rio Rancho. I've been there for a few years, really enjoy it. So Smile Generation is a referral network that's designed to send patients to qualified dentists.
Okay, and so you're part of that?
Yeah, so I'm part of the Smile Generation network. We have practices 10 or 11 in Albuquerque, Rio Rancho, and Santa Fe. You know, our typical patient is a patient who wants to have a cleaning done. They'll come in for routine dental care, for fillings, for crowns, for bridges, for cosmetic makeovers, for smile makeovers. They'll come in for oral surgery or for root canals. My big focus is to help patients with implants and teeth. We want to get those patients that have dentures that are not fitting so well, or get them a fixed set of teeth that goes in and stays in, that they don't have to worry about coming out when they're out on a date.
All right. Now you have this concept of where you do everything right there, right? I mean, you have specialists there. I mean, it's kind of like all under one roof.
Right.
Like this same day dentistry kind of a concept. Is that right?
That's exactly right. Our goal is to have all the specialists in the office, so the patient gets to come to one place, and we can treat them anything they need. Orthodontics, oral surgery, root canal specialists, gum disease specialists, they're all there. And then we've got a number of general dentists as well to help them with the routine dental work.
Okay, now at the top of our show, you said nobody should be wearing a loose-fitting denture. Is that the newest trend in dentistry? That means that traditional dentures someday will be out? That means they'll all be attached to dental implants in the future? Maybe it's 10 years or 50 years?
I think so. You know, for my experience, I think patients with loose-fitting dentures that are uncomfortable, that are painful, causing them issues, is going to become a thing of the past. And our goal, like I said, is to help patients get past that, to get past the concerns that they have, the fears that they have, and help them get a denture that fits, that's stable, that stays in, that they don't have to worry about coming out.
So where you are there a lot of people that are wearing a denture, like an upper-lower denture, or about to have dentures?
Yeah, so the short answer is there's probably tens of thousands, maybe hundreds of thousands of people in New Mexico and in Albuquerque area specifically that either have dentures, a loose-fitting denture, or are headed to dentures or need dentures at some point. And if you took the Santa Ana Star Center, if you took the Wise Pies Arena, and you filled that up, we could probably fill it up 10 or 15 times with all the people that need dentures or are headed that way or have dentures already.
If it's so good then, getting dental implants to secure that denture, lock it in, why aren't they all doing it? What's your take?
So I think there are 4 or 5 reasons. Probably the first reason is most people that have dentures are pulled out of the system. So they don't know what options they have. They get their teeth taken out, they get a denture inserted, then they think the only time they need to come back is for a reline or an adjustment on a sore spot or a tooth popped out. So we never see them, and so they don't know what choices they have.
So they don't go to the dentist?
Exactly. Okay. They don't go to the dentist, they don't know what choices they have on the table. So, the second reason would be, if you're a denture wearer, for instance, the 10 or 15 years that led up to you getting dentures are probably some of the worst years of your life. If we think about all the pain they go through, if I'm a denture wearer and I'm getting to the point where I need those dentures, I've got painful teeth, I've got infection, multiple trips to the dentist for root canals or tooth extractions. I've got issues with the way my teeth feel, the way they look. I'm embarrassed, they may smell bad. So a lot of those patients, once they get to the point where the teeth come out and now they've got dentures, they're done. They're comfortable, so to speak.
So the last thing they want to do is go to a dentist.
Exactly.
Do you still hear that, by the way? I mean, you seem like a nice guy, right? But I mean, do you still hear like, hey, no offense, doctor, but I don't like the dentist?
Yes, almost every patient says that.
What do they say?
So, yeah, I don't like the dentist. I don't want to go in. So, they're afraid to come in. They're afraid of, these patients that have the dentures, they're afraid of possibly having some pain. We have patients all the time that are worried about having pain for routine dental work. You know, when you're talking about dental implants or something to hold in a denture, that's even more of a concern to them. So the nice thing about the way we provide care is we have several different ways that we can get them past that anxiety and that fear. You know, we can give them a pill the night before to help them sleep. We can give them a pill when they come in to help them, you know, relax and be calm.
It's like oral sedation?
Yeah,
Okay.
yeah, that's one of the options we have. So another level of comfort that we can offer our patients is IV sedation. So they'll come in, they'll have the dental work done, and most of them don't even remember that they had their procedure done. So fear should not be an issue to keep patients away from having this procedure done where we actually give them a fixed set of teeth. So the fourth reason people don't come in is because they think they're too old. They think they don't have enough bone, or they think they're not a good candidate to have the procedure done.
How old can you be to go in and get your denture locked in with dental implants?
So I've actually personally treated patients who are in their late 80s for dental implant procedures. Went fine, no concerns.
So somebody at that age, why would they want to do it?
Because they want to eat and chew.
Okay.
You know, like you and
Fair
I.
enough.
If you're lucky enough to be around into your old ages and you've got grandkids and great-grandkids, when they come to see you, they're going to be bringing you food. And what's the one thing you want to do is to be able to eat that food with them.
Are there a lot of people that can't eat with their denture? I mean, do you hear these stories?
We hear these stories all the time. You know, patients will come in and they'll complain, you know, basically you're rubbing plastic pieces together in your mouth. It's very difficult to chew out with dentures.
Okay, so, but isn't it true that if you've been wearing a denture for like 20 or 30 years, you can't do this? You don't have enough bone?
No, that's not the case, but a lot of people think that. They've been told by another dentist, by an oral surgeon, by a friend, by Google, that they don't have enough bone. The nice thing is, with today's modern techniques, with guided surgery, with 3D imaging, we can help almost everyone. There are very, very few people who we can't help because of the bone.
Now, you've been doing this a long time. I guess over 1,000 of these procedures.
I've done a lot of these, and you know what really gets to me is how we can impact a person's life. Let me give you a story.
All right.
So I have this one patient who came in. She had a full upper denture. She'd been wearing a full upper denture for a long time, was really unhappy with it. She had a lower partial denture and her teeth were starting to fall apart. So she came in to ask me some questions about what choices she had. We talked about the choices after we got a good x-ray, gave her some ideas of what she could do to help get her teeth back to where she wanted them to be, and she actually left the office in tears. So when she came back, it turned out the reason she was crying was because she was happy that she had an option other than a denture that was loose fitting like she had before. So for her, here's what we did. We gave her 4 implants on the bottom with a fixed set of teeth that doesn't come in and out. She can't even take them out if she wanted to. And we did the same thing on the top, fixed set of teeth, beautiful smile, beautiful white teeth, nice natural looking gums. So now she can go on and she can eat whatever she wants to eat. She doesn't have to worry about her dentures coming out if she goes outside to play tennis. She seemed much happier and she was a transformed lady.
You say that you see actually personality changes when they come in when it's all done.
Yes.
Is that right?
Yes, we do. We see a big change in some people because the smile is so important. The smile is our first communication to a lot of people that see us. So those of us that may have a denture that's ill-fitting or doesn't fit right or is sore, we're trying to hide our smile. Or people that have teeth that are going toward a denture, it's the same issue. They're trying to hide that.
You're a dentist, so you probably think the smile is like the most important thing.
I do. But if you look at all the studies that have been done about what's one of the most impactful things that people see first on a person, it's their smile.
Okay.
So the smile can be very impactful, and it also changes, you know, self-confidence, self-esteem. We can really have a big impact on people by giving them that smile that they're comfortable and confident in. So Randy, imagine this. 2 people go into a job interview, all things equal. If you look at the person that smiles versus the person that doesn't smile, who are you going to hire?
Yeah. Well, the one that looks happy, right?
Right.
That's positive.
Right.
Interesting. So as a dentist, you could spot it around town. You're in Albuquerque and you could tell who's hiding their smile?
A lot of times we can. You know, they're the people that you talk to and they keep their lips around their teeth. Or there are even some people that try to cover their mouth when they talk. So we see that all the time, and it's heartbreaking to see people like that.
Now, this can be done in one day. So for example, on the day of the procedure, and correct me if I'm wrong, somebody could actually walk in without teeth and walk out with fixed teeth that don't come in and out. Is
That's
that
right. That's
like
right.
a full arch on the lower, full arch on the upper?
That's exactly right. And let me tell you a story.
Okay.
I had an older gentleman who came in. He had teeth that were breaking apart. He had a decent smile in the front, but his teeth were falling apart. He was in a lot of pain. He asked me what he could do. And he had already been told by his father, his mother, his sister that dentures were the only choice for him. Well, we were able to do that all in one appointment. We took out his teeth, we put in implants, did the same thing, a fixed set of teeth, same day. So he didn't have to worry about wearing adhesive, he didn't have to worry about wearing a denture, he didn't have to worry about those teeth falling out again.
how soon can they eat? Okay, so if everything goes right, I should say. Okay, everything goes right. You give them a full arch of teeth, snap in, snap out, or fixed. How soon can they eat?
Same day.
Really?
They can eat the same day. Yeah, there are very few limitations we put on those patients. Assuming the procedure goes smoothly, there are very few limitations. So I had this one guy that came in, and his was just the lower teeth. He only had problems on his lower teeth. His upper teeth were in pretty good shape. So he came in, we put in 4 implants, did the same thing. We did a fixed set of teeth. Stays in, doesn't come out, he can't get it out. So as they were leaving, his wife's asking, can he eat? When can he eat? Do we have to wait a few weeks? What's the process? And I said, no, you can eat now. And so she told me he was going to go out and eat ribs. And they went out and ate ribs that day.
Really? Are they a little bit afraid? It seems like a little scary.
They are. Most patients are worried. They're nervous that things aren't going to feel right or work right. But for him, and he came back about a week later for a follow-up, everything was perfect. He said his lower teeth felt as natural as they had before they came out, and they matched perfectly with his upper teeth.
Now, and as far as eating, I mean, could you eat when they're healed up and you've given them a full arch of teeth, either a snap in, snap out? Could they eat like things like broccoli, or could they chew things like a pizza or chewy things?
Sure, they can eat whatever they want to eat. There's really no limitations to what they can eat. They can go right back to what their diet was before they started having tooth problems. You know, carrots, salads with cucumbers, nuts, pecans. I know a lot of ladies that like to snack on pecans and cashews. So there's really no limitation to what they can eat. Everything functions just like a natural set of teeth would.
So this is the newest, hottest thing then in dentistry, is dental implants.
Yeah, it is. So look at it this way. It's like your third set of teeth. You have a baby set of teeth, then we have an adult set of teeth, and then some of us have problems with those. So we can give you a new set of teeth. And this is a set of teeth that's permanent and won't decay and won't fall apart. So it's a great option for those patients that have issues with dentures or that are heading to dentures or that don't have teeth and want teeth.
Because I know a couple of denture wearers, right? They never complain. Are you saying there's no such thing as a happy person wearing false teeth?
Well, they wouldn't complain to you, but they complain to us all the time. You know,
all right.
The first thing a patient says that has dentures when they come in is, you know, can you fix this rough spot? I hate how this feels. I have to use a ton of adhesive to get this in. So when we can take them from a loose denture that they use tons of adhesive every day to something that snaps in, that they can still take out if they want to, but don't have to, or a fixed set of teeth that stays in forever, you know, it's a great option for them.
So what about maintenance?
So maintenance is just like natural teeth. You brush them just like you would at home. You come in every 6 months, so these people are happy. They feel like they've had a real transformation. So back to your question earlier, why aren't all the people that are missing teeth or have dentures that don't fit, why aren't they coming in? Well, one of the things that concerns them is expense. A lot of people think, I'm missing however many teeth, I need 1 implant for each of those teeth. Well, that's just not the case anymore. You know, we can replace all of your teeth with a few implants on the top and a fixed set of teeth and a few implants on the bottom. Depending on your bone, we don't have to do 1 tooth per implant anymore.
Okay, now you call it all on 4, but all on 4 means the number of implants?
That's correct. So all on 4 is the number of implants. You get 4 implants and you get a screwed in fixed set of teeth that doesn't come out. Now some people need 6 and it just depends on your situation, but you don't need 1 implant per tooth.
The way you do it at your centers is a little bit different, you say. So I guess the way it's normally done is you go to one doctor for the surgery, and then another dentist puts the tooth on top, and maybe another place for the imaging. You do all 3 parts.
That's
Is that right?
It's all done in the same office.
Aside from convenience, though, is there any other benefit to that?
There are a lot of benefits. You know, one, if you look at time, it's faster. You don't have to set up multiple appointments. You get to come to one office and have it all done in the same appointment if possible. 2 is communication between the doctor and the specialist if you're using a specialist. That allows us to communicate because I can walk down the hallway and talk to the oral surgeon who's placing the implants. And then 3, there's just a great amount of benefit for the patient because they don't have to go anywhere else for any images or any follow-up care. It's all done in-house in one location.
Now you also have technology, I guess, a machine, I guess like a milling machine that makes the crowns right then and there, the teeth right there on the same day.
We do. So we can make crowns for patients, bridges for our patients, veneers for our patients in one sitting, one appointment. There's no temporaries. You know, a lot of the old techniques involved sticking in a goopy impression, you know, filling up your mouth with this stuff. And then it goes to the lab, you get to wear a temporary, it comes back 2 weeks later and you get a crown that may or may not fit. With us, with all of our centers, all the Smile Generation supported offices, we have a machine in our office called a CEREC machine. So when all the drilling's done for the crown or for the bridge or for the veneer or for whatever it is, we use a little camera to take pictures. So it's all digital.
Like a wand in their mouth?
Like a wand. Yeah, it's kind of like a large pen, basically. We put it in the mouth, we take pictures of the tooth, we design it on a computer right in front of the patient, and they can tell us what they want it to look like if they want to. And then we have a machine that makes it for us. We go out, we get it out of the machine, we put it in the mouth, and it's done. One appointment.
Let's talk about the denture wearers for a moment. Okay, so if a denture wearer goes into your office, what are their options? Like, what's discussed? They're sitting there in front of you. What do you tell them?
So what I usually tell them is I ask them if they're comfortable with their denture, if they want teeth that are going to stay and they're not going to have to worry about them coming out, and what their long-term goals are. And for me, most of my patients want to have teeth that are comfortable, that look good, and that they work well, and that they don't have to worry about them coming out at all. You know, kind of the starting level would be 2 implants with a denture that snaps in and snaps out. The nice thing about that, have a patient who we did that for, and the great thing was it was less expensive for her, very fast procedure. One appointment, we were able to attach those implants to her existing denture, use the same denture she had before.
So you could use their same denture?
We can. You can use the same denture, add the implants to the mouth, snap in the denture, they're done. They walk away with a denture that snaps in same day. Don't have to worry about, you know, eating food and have that denture flop around in the front. It gives them some good stability. So with the 2 implants and a snap-in denture, you can eat almost everything that you wanted to before. The problem with that is you're going to have a little bit of rocking in the back, but you can eat your salad, you can probably eat a sandwich, you can eat most of everything that you used to eat in the past.
But it's much better than a denture.
It's so much better. They don't have to use adhesive, that goop that changes your flavor and is tough to get out of your mouth and your teeth. So the next step up is 4 implants and a full arch of teeth that snaps in. So they can snap in, snap out. You don't have to use any adhesive.
You do a lot of those?
We do a lot of those. A lot of our patients opt for that because they're more comfortable. They can eat just about everything they wanted to, everything. It's comfortable. They can do water sports. You could go skydiving if you wanted to, not worry about your dentures coming out. Don't know if you're a skydiver.
No, I'm not.
But that's a great choice for most of our patients. It's fairly economical, but you get a snap in and a snap out. Very firm, good, solid teeth to work with.
Now, insurance doesn't cover this, like you know, Medicare, Medicaid, but you work with people, right? I mean, in the U.S., it's not covered as far as the whole procedure.
Right.
But you have financing and things like that.
We do. You know, our goal is to make what you want as far as dental care is concerned fit into your budget. We have all sorts of payment options, in-office payment plans, financing options. Our goal is to help this be the easiest choice you've ever made.
Okay, now I interrupted, but the next level up, okay, so 4 implants, snap in, snap out, full arch of teeth, what else?
So the next level up would be to get 4 implants or 6, depending on your need, and a set of teeth that stays in. It's either cemented or it's actually screwed in, so you can't get it out. The only difference between that and natural teeth is the dentist knows that it's not natural teeth.
So they can look real, because I feel like I could spot, knowing, you know, anticipating this interview, I feel like I could spot fake teeth walking down the street.
Yeah, I don't think you could if it was done well enough.
So these look real, they look good.
They look real, they function naturally, the gums look perfect, they look like natural teeth. So when we go to the fixed set of teeth, a full arch that's attached permanently that doesn't come out, these people can eat anything. And they could literally eat anything they wanted to, even stuff that wasn't food.
Popcorn? Could they eat popcorn?
Popcorn.
Nuts?
Nuts. You could probably pry open the cashews. You can do just about anything you wanted to with those fixed teeth. A full arch of teeth that doesn't come in or out.
I think you told me on the telephone that there are people wearing dentures, like an upper lower denture, and they're married and the spouse doesn't even know about it.
Yeah.
Really?
Yeah, it's a tough secret to keep. You know, if you can imagine having a full set of dentures that come in and out, you're going to have to work around your spouse's schedule somehow to get that denture out, to clean it at night before bed, or whatever you end up having to do. The drawback of that is it's a little secret that you have to keep. So if you're going to go out and date, you better have a way to keep that secret from whoever you're dating or something like that.
So no more dentures. You're going to wipe them out in Albuquerque, by the way? That's around New Mexico?
Yeah, that's the goal. You know, and our big push is we want you to know your options. We want you to be able to make an educated decision that works best for you.
What about gums? Okay, so people with bleeding gums, bad breath, I mean, they're losing their teeth because they have bad gums. Are the gums, for those people, that means they're about to lose their teeth, are they too bad to support an implant?
No. So once the gums are treated, and for some people that may be taking the teeth out, the gums are perfectly healthy enough to support implants. So it's a great choice for a lot of people if they've got unhealthy, bleeding, bad smelling, bad tasting gums and teeth, you know, to consider these implant options, because we can get the patients from having this bad situation, lots of pain, to where they've got a fixed set of teeth that's permanent, just like their original set of teeth when they were healthy.
Because you said people that come to you haven't been to the dentist in like 10 or 15, 20 years, right?
Right.
And they're probably embarrassed. I think you told me they're embarrassed.
Sure.
What do you say to them? They're watching this, and even they are skeptical.
Sure.
What do you say?
So the first thing we want to tell you is to come in and talk with us. There's no judgment. Our goal is to help you get from where you are now to a comfortable set of teeth that you're happy and confident in. So we had this one guy, teeth broken down, gums bleeding, really painful, lots of infection. You know, he was a really kind of a cranky guy. He was unhappy all the time, and you could just get that vibe from him. He was not happy. We went ahead and went through this procedure. It took some convincing. He didn't think that it was going to work out for him. But in the end, you know, when he comes back for cleaning, comes back for follow-up care on the fixed set of teeth we gave him, he's a totally different person. He smiles, you know, his clothes have changed, his facial expressions are totally different. He's just a completely different person all around.
But what about people that are just missing like 1 or 2 teeth in the back, right? Seems like people tend to lose their teeth in the back first.
They do. A lot of us lose our...
So why a dental implant over like a bridge or whatever, or doing nothing?
So a lot of people lose their molars first. For whatever reason, they tend to have issues first. And the challenge that happens is if we lose those back teeth, over time what's going to happen is you're going to start to chew forward. And then those teeth aren't designed for all that chewing force. So they start to have problems too. And then the teeth above or below the missing tooth start to shift into that space, which creates gum problems, which creates bleeding gums and gum infection, which again is another big problem. So it's this kind of this big snowball rolling down a hill. It just gets worse and worse and worse. Now, if you're out there listening and you've got, you know, you're missing teeth, then if we can get some teeth placed in there, some dental implants, something to give you back that chewing force, we can stop that snowball. We can give you something to use so that it doesn't become a long-term, lifelong problem.
Because those people might be headed to dentures. I guess it all starts with 1 tooth, right?
It does. It does. It all starts with 1 tooth. Let me tell you a story about a gentleman that came in. He was missing, I want to say 6 or 7 teeth, kind of spread throughout his mouth. And his wife was the one that brought him in. She pushed him to come in because she didn't like the way his front smile looked. It was missing a couple of teeth here or there. So guys are like that. They just put things off. So finally, she brings him into the office so that we can get things fixed for him. So we ended up putting in 6 or 7 individual tooth implants and gave him his smile back. And it was perfect because he didn't have to wear something that came in and out. We didn't have to drill down the adjacent teeth. We put in those tooth roots, the implants, put on the crowns, which were made in the same day with our dental crown machine, all digitally, no goopy impressions. And he ended up leaving with a smile that he felt good about and that his wife remembered.
Okay, so with this guy, and most people are like that, right? You know, you're in so much pain, you go.
Right.
So if you're in pain, come in early. But that's tough, right? Getting people in early?
It is. It's difficult.
It's a lot less money when you see them earlier. Is that true?
It's a lot less money. You know, on the front end, if we can fix a problem before it becomes a giant snowball or a giant catastrophe where things are breaking off and really infected, it's a lot cheaper in the long run. And the solution's a lot faster and simpler.
Good. Okay, so teeth in a day. That means you could have somebody, again, that walks in without teeth, and they may have an appointment beforehand, right?
Sure.
But in one day, they get a full arch of teeth that don't come in and out.
Exactly.
Well, sounds like that's what everybody would want, right?
Naturally, it sounds pretty natural to me.
They're just skeptical, I guess. They don't believe it.
Yeah, I think a lot of it is they don't believe that it can be done. But with a real small amount of prep work, with the appropriate planning, yeah, we can have the implants placed, those posts placed, teeth taken out if there are any, and a fixed set of teeth that goes in the same day.
Is that right? And then they're eating the same night.
They are.
Soft food, though.
Soft food for a few weeks.
Could they eat chicken or?
As long as it's soft.
All right.
And not alive.
Then how soon? Like 2 weeks later, not alive. That's a good one. By the way, I've been told you're considered a funny guy. So you have fun with your patients.
We try. You know, I try to bring the stress level down by making it a real comfortable environment. We want our patients to feel like family. So if they can come in the dental chair, and even though we're taking out a tooth or drilling a hole in their tooth or whatever we're doing, if we can make it comfortable with a little bit of humor, that's the goal.
We are just about out of time. But if somebody is watching this and either they're about to lose their teeth or they've got a lot of problems, or they're wearing a denture, but they're still skeptical, they're afraid, what do you say to them?
So what I'd say is come in. You may not even know what options you have available to you. If you're perfectly happy with your teeth, you don't necessarily need to come in. But my feeling is almost everybody with dentures could feel like it could be better, something they could improve, whether it's, you know, changing the way it feels and fits, to actually getting it to stay in without coming out, not having to use that adhesive, not having to worry about when you're out at dinner with your friends, worrying about being with the grandkids and holding that new grandbaby and worrying about your dentures falling out. You know, we can help. And there are lots of different choices for you if you're interested.
What about pain? I mean, this seems like it would be very painful.
And that's a very real fear. Most of our patients have that fear. But the good news is I'm not going to feel anything during the procedure.
Okay.
And we don't want you to feel anything at all during the procedure as well. We want you to be comfortable.
So they're numbed up.
So they're numbed, and if there's any pain during the procedure, we want to know about it so we can stop. That's always my promise to my patients. If you feel anything, stop me. We'll give you some more numbing if we need to.
So you do like oral conscious sedation, so they could talk to you.
Sure. Yeah, they can talk to us, ask us questions. Need to use the restroom, I need a jaw break, whatever they need to do. There's all sorts of time for them to give us input. So we manage their pain in a number of ways. Of course, during the procedure, we numb them up, make sure they're comfortable during the procedure so they don't have any worries about feeling anything during the process. Then after the process, we have someone that takes them home, will watch over them. You know, usually it's a mother, a sister, a brother, a chaperone to be with them. We'll give them painkillers as needed. For most people, it's a few ibuprofen and they're in good shape.
Is that right? So you could just take like the ibuprofen. I mean, you have a few patients that do that.
Yeah, we have a lot of patients that ibuprofen is more than sufficient for them. It's a very simple procedure, and usually the pain during and afterwards is very, very minimal, if any at all.
Are they ever surprised where they say, this was better than I thought it was going to be?
We have a lot of patients that are pleasantly surprised. A lot of them feel like it's going to be this horrible procedure. You know, they've been through a root canal in the past. They've had a tooth taken out that was just a nightmare. This is very different. We want to make sure you're comfortable, you're happy. Okay. And our goal, again, like I said, is to make sure that during the procedure you don't feel anything at all. And if you do, we want to know about it.
So if you're in your 80s, 90s, it's not too old?
It's not too old.
Like what are, I mean, so that scientifically or statistically, the implants aren't more likely to fall out if you're 85 or 90?
Nope, there's no change in the long-term success rate. So almost everybody, depending on your medical history, but almost everybody is a good candidate for dental implants. It has the highest success rate of anything we do in dentistry. So for just about every patient that's out there, no matter how old you are, no matter what your medical history is, we may want to talk to your doctor, but almost everyone we can help. There's really no upper age limit for placing dental implants and doing these procedures. It works for just about everybody out there.
Now, one of the nice things, and you were telling me this on the phone, that when it's all done, that many of these people, because they really didn't like their teeth or like their denture for 10 or 15 years, that they say, I should have done this years ago. So you hear that? We
hear that all the time, you know, especially when we hand them the mirror after we've put in their teeth that don't come out anymore, and they'll look at that mirror, and I've had a lady that sat there and stared for quite a while. She just could not believe that she had her smile back, and it was a smile that didn't come out anymore. So everybody is pleasantly happy, pleasantly surprised when we do this procedure. So I had a patient, we inserted a lower fixed set of teeth, and we put in some implants, we put in his lower teeth, and I handed him the mirror. And he sat there and stared for quite a while. He was just very happy, very surprised to have his teeth back. And he told me a couple of different things. He said, one, that was a lot easier than I thought it would be, and number two, these look and feel like my natural teeth. He went out and got his wife. She came in and she told me that this looked like the man that she had married.
Is that right? Well, good for you. We are out of time, so I want to thank you for coming on the show. Final message to somebody that's watching this program, either they're losing a lot of their teeth, or they're bad, or a denture wear that says, my denture's fine. What do you say to them?
Come in. Let us tell you what choices you have, what options you have available to you. You know, there's no harm in looking at what choices you have in front of you. So come on in, let us talk to you, let us find an office that's close to you, that works in your time schedule. We'll tell you what choices you have available and see if there's something we can do. And I'm almost 100% sure that we can help you in a lot of ways.
Okay, good. I want to thank you for coming to the show. Very good.
Thank you.
You've been watching The Wellness Hour. I'm Randy Alvarez for now. I wish you good health.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.